What would happen if the life sciences industry measured performance the way Olympic athletes do, where every rep, every decision, and every unseen habit adds up to a predictable win? Welcome to Industry Ignited, the podcast where we explore the leaders, ideas, and innovations reshaping how the world builds, heals, and grows. I'm your host, Dr. Leeanne Aguilar, and today we're diving into the future of work in healthcare. My guest is Dr. Tim Mikhelashvili, a doctor of pharmacy, senior pharma, and biotech leader, and the CEO and co-founder of Amadea Pharma. Tim, welcome to Industry Ignited.
Thank you, Leanne. Huge pleasure to be here.
So let's start at the beginning. You've talked about being disturbed by unsanitary manufacturing conditions and drug recalls early in your career. What was the moment where you said, I can't just dispense drugs. I need to help change how this industry operates?
Yeah, so I was graduating from pharmacy school in New Orleans, and there were several different high-profile drugs that were recalled after they came onto the market, which to me was unacceptable. I was a pharmacist. I was considering a career in the pharmaceutical industry, and I wanted to really study the outcomes of medication errors and find ways to prevent them. And there was this 60 minutes TV broadcast where I had seen young gentlemen manufacturing drugs in conditions that were so unsanitary, so poor, that were hard to even imagine. I thought to myself, why don't they think about their own mothers, their own grandmothers, who would one day have to take those same medications? And our dean of school of pharmacy happened to have pursued that career path in the pharma industry, and he inspired me. I actually asked them to create a first of its kind type of a fellowship, an internship in the pharma industry during that graduating year, the last year. And my rotation was all the way in Chicago, and this was the first time they had done that at the pharmacy school. And I set on this path of preventing medication errors and improving the quality of medications, which is so critical for changing the course of disease or even preventing, right, many conditions.
Yeah.
So.
Wow. Yeah. So that's inspirational. So you actually watched a program where you identified the need and you saw the conditions under which these medications were being manufactured, and really just got you thinking. And so from that point, you set your course intentionally and even worked with the school to create something that wasn't there. And yeah, that's amazing. Now, you've worked with big pharma, specialty, and startups in multiple therapeutic areas like cardiology, GI, rare disease, oncology, and more. Looking back, what were the key turning points or pressure moments that shaped your philosophy about performance, quality, and leadership?
There were quite a few of them. So, I mean, the challenges, the conflicts, and the disappointments actually played a huge role in helping me grow and understand that leadership is a way of life. It's something that you can always control, no matter what position or title that you have. There were some tough decisions that I made. I was willing to take, and to make early on during some turning points, of my career that allowed me to continue to create some momentum as well, right? Find opportunities and capitalize on them. When I came into the industry, I thought that my work would speak for itself. I demonstrated scientific curiosity. I was developing lots of important relationships with some leading scientists at scientific conferences, with PhDs, global thought leaders whom I would otherwise not really be able to meet. And I appreciated those opportunities, and I stepped in and I really showed initiative. But what I realized is that some of these disappointments of people that you felt like you internally you had great relationships with, that that didn't always support you, or when you needed it most, right, when you needed a particular position. And that's when I decided to take kind of the environment and the circumstances into my own control, ask for a few days off, attend a seminar where I networked with a lot of people who had already been great at what I saw myself doing in the future. Mm-hmm. Right. And it was difficult to do that, given that I was, let's say, an early career student, a fellow. Right. And I was told by a supervisor who I was inspired by that, look, you're just a fellow. Look, I know a lot of people, they have to go through many more steps, to reach what you're trying to reach, right? This role. And, that's when kind of I took matters into my own hands. And these were some of the early decisions that allowed me to actually land my first role, for example, right? And then later on, also, I really learned that success is something that you create. It's something that is what other people define for you. Others have to recognize what success is. Happiness, in my definition, who is by your side regardless, which is difficult to control also, right? Whether it's in personal relationships or professional relationships. Yet leadership is something that I realized is something that you yourself can create. Even when I did, I basically fulfilled the same types of roles. I searched to do something different in every progressive role in different companies, in oncology, in GI, and hepatology, because I wanted to collect experiences, different experiences. And I also observed a lot. I observed people who cared about quality, people who challenged the status quo, the innovators. Those are the kinds of people that really became role models for me, even early on. And I kept setting goals for myself to reach that kind of mastery, if you will, or professionalism and initiative when I would reach, let's say, that age, right? And that, that milestone, for example. And that's what kept me going, because my life has two directions. Progress and success. They're the only directions in my life compass, if you will. And I think being able to observe other people, not just the technical performance, not just what people say, but their actions, how they support what they say, how they practice what they preach, and setting the right kinds of standards for myself and milestones really helped me shape my philosophy of, yes, always continuing to focus on quality of work, but then later on in my career to also observe and form the right relationships with people, which I didn't value as much early on, because the quality of the work is not going to always speak, particularly in the corporate environment. You need to form the right kinds of alliances and the right kind of people, surround yourself with the right people to bring out your potential.
Right. Yeah, that makes sense, to support you and so you can grow in areas that, you don't have knowledge about yet. It's like those alliances, those relationships can just help, I guess, boost and get you even further and educate you. But I'm hearing that you are very intentional about, setting your direction, about progress and success. But it sounds like, I mean, even early on, that you had an idea of where you were wanting to go. And even though people were saying, well, you can't do that, or this isn't the way, you were kind of breaking the mold and you were pushing forward and creating your own path despite what others were saying. Yeah. Now, you've described your mission at Amadea Pharma as raising new standards of healthcare quality. If you had to connect that mission to one personal value or formative experience from your early career, what would it be and why?
So I would say that I think raising new standards of healthcare quality assumes that you are looking to leave a legacy, that you are searching for progress and success as your only two directions in your compass, right? In your work compass as well. But you know that life and your industry, your field is much bigger than you yourself. So you want to make impact. So, I mean, my personal motto is that I didn't want to just work. I wanted to work with meaning. I wanted to work with impact, and I wanted to translate my daily contributions, my collaborations into impact. Find a way to create momentum for my team, because it is a duty, I believe, for all of us. If we spend most of our life at work, whether it's in healthcare, where it's very busy, right? Where work doesn't seem to stop, particularly today, right? Then it's our duty to make sure that we learn from our previous mistakes, or we tell our leaders, our executives, regardless of the roles that we hold, we make the right recommendations so that they don't make the same mistakes, so that they continue to improve incrementally and reproduce their results, their successes, their records.
Right.
So that's really the impact here. And this is why I really classify Amadea Pharma as an impact agency. It's an impact healthcare agency, that bridges the gap between analytics and organizational change, between performance and behaviors, between metrics and culture, right? So legacy. It's a legacy for your profession. What are you going to do in your professional career? What mark are you going to leave in your industry, in your field? Right. If we've made so many advances in medicine, then also we need to ensure that the next generation lives longer. And that's why I'm very excited about longevity medicine, for example. And so that's just kind of an example of where my interests are. They're always kind of are looking forward into what we can do for continuity of generations, so that
Right.
we learn across generations as well. Because
Yeah, so it's like a legacy, not only building your legacy, but building a foundation from which others can take and expand even further. Yeah. So many people burn out after 20 years in a highly regulated, high pressure environment like pharma and biotech. What kept you in the game, and what eventually pushed you to step out as an entrepreneur and founder?
I was always willing to take risk, particularly after I had amassed enough experiences where I felt like I could now take my observations, my in-depth observations, right, and now make right recommendations on the organizational leadership perspective or category, right? Because earlier in your career, you focus on your technical aspects, the skills that you collect, right?
Hmm.
Then you learn how they impact team dynamics, the organizational structure, the strategy. And so in the last, probably I would say 6 years of my corporate career, I started to study organizational change. I received a certification, took a course from MIT in leading organizations and change. The professor of that course is actually one of my board members at Amadea Pharma, Melissa Norcross. I want to recognize her. And you're right that it's not very easy. It's to work in a high pressure environment. Particularly in pharma, right, in the corporate environment. And you have to have a certain kind of inner calling, if you will, that, stimulates you to regulate how much you're willing to risk.
Hmm.
Okay. And how much you're willing to speak up for others when they're quiet, when what, is bothering them, what they feel is unjust about how they're not recognized. And so I started to really demonstrate my character, because my character, I would say, throughout the 21 years in my career, never really changed. I maintained and I said that even in my very first role, and I was actually mentoring a new hire, and there was someone who was more senior, and he had made a comment about that seemed to be kind of threatening, almost like, I got you, I caught you doing this. And he said that in front of me, and kind of stopped him right then and there, in this conversation of three of us.
Hmm.
And I was just starting out back then. I told him that I stood for some kind of principles. Basically, I made that known to him, that I believe in the company culture, but I had my own personal set of ethics and character that I carried. My character served to my benefit and also to my detriment in some regards as well throughout that time, because unfortunately, in a structured setting, you may be fulfilled with how you acted, but it may not always lead to opportunities. So, or it may not always drive the kinds of results or promotions, let's say, right? So I went for various different promotions, let's say 5 times. I got 2 of them, right? I didn't always succeed, but for me, it was what was first and foremost was that I had to be content consciously with all my actions,
Hmm.
right? So I had my own set of morals that preceded anything else. And so to get back to your question, I guess, of, burn, how I stayed in the game. Well, I stayed in the game because, despite being a person who stood stood up for other people and for particular values. And as a result, I was given that role, let's say, of leading company culture initiatives on behalf of
Okay.
medical affairs and startup companies. But I also drove tangible business results, with my character, right? Where I had to convince the chief medical officer, the CEO, to do a very risky head-to-head study of this one startup where I was working that was competing against the market leader, much larger pharma company, which had much more funding behind its product. And it took me 2 years to convince them. I had to bear a lot of disrespectful comments as well, like this is a waste of time. Lost a lot of hair. My hair is gray right now because of probably that. This was 2016. But at the end of the day, I remember that feeling of finally publishing this late-breaking abstract in a large, international conference, standing there at that poster with a global thought leader with whom I co-authored it, and then hearing comments from our VP of marketing and seeing Bloomberg come in and, write articles about and hearing from the marketing VP from our company saying that, look, as you're presenting this, our shareholder price is now increasing for the first time in years. And then
Wow.
our sales team writing emails to me in this medical team that I led to finally, publish this article telling me, look, you've re-energized the company, And so to me, that was kind of like a milestone that I had reached for myself. Now, I had built a case for our team to for my manager to receive a promotion. Not one person received the promotion, but regardless, it was an accomplishment and an example how a function that is not directly tied to sales and revenue actually had direct business impact. We
Right.
turned around a failing launch, and we drove $40 million in revenue in 4 hours
Wow.
in that poster,
Yeah.
which was confirmed at that point.
Yeah.
So
Yeah, so just standing by your ethics and your values and ultimately creating an opportunity for yourself where you could help implement that into a business that then ultimately grew the business by, you know, in a tangible way. And what from there, what led you to want to be an entrepreneur and take this and create your own business?
So I really searched deeply within kind of myself in 2014, 11 years ago, after witnessing a very unique success story of a company where I was, which had set as its goal to not just grow or not just be successful, but be the leader in their field. This was a small startup company that started with just two people, and I saw how they approached performance. I saw also their gaps, but this was completely different approach than one used by larger pharma companies where I had worked previously, for example. And the company grew, scaled. Our medical department was recognized by everyone, including the CEO. We had our own publication, an internal journal that everyone read. So I saw the impact that had. And so we became the largest GI company in the world as a result, before it was in turn acquired. And when it was acquired, I had time to kind of reflect. I wasn't in a hurry to find the next role. I wanted to make sure that I found the right role. And that's when I started to think, look, I founded Amadea Pharma first. Even back then, I registered the company together with my wife, and I reflected on how to replicate that, how to fill in some of the gaps that I saw there, because it analyzed performs a lot of detail. It provided a lot of resources to train, to learn for a company only of the small size like that, right? It was a unique kind of observation for me, reality. Did it have the best culture? Not necessarily, but it provided all the resources you needed to have the right culture and to just be accountable for your performance at all the time. So, I mean, that was a very memorable type of, I think, experience. And also, I searched back to really what would I have to do to not feel like it's work if I started my own business,
Hmm.
right? And for me, that was really combining elements of sports and data science to generate excitement and to ultimately scale excellence in a predictable way. and because I was always inspired by sports athletes, the transparency, the sportsmanship, meaning you're accountable not only for your performance, but for your behaviors, and I always was a person that was analytical. I was able to analyze a lot of complex data where I thought numbers matter, and you have to communicate numbers with the right numbers with the right people, the numbers that matter with the people that matter. And so that's when I started the company, and I first started to do consulting part-time, but now we're a tech company. We've actually distilled all of these lessons from failures and successes into a tech platform.
Yeah. Now, for listeners who are new to Amadea Pharma, how do you explain in simple terms what you are and what you do and the problems in life sciences you're uniquely obsessed with solving?
Yeah, so we help life science organizations that aim to become leaders in their fields grow their business and their patient outcomes via a tech platform that transforms their employees into sports athletes and scientists who go to work every day thinking, what can I do better? How can I contribute more? Regardless of their title, regardless of their background, they become now sports athletes and scientists. Okay. As a result of this tangible, practical, simple, centralized tech platform called Ancora, which ensures that your organization, if you are that organization that wants to operate like an Olympic team and wants to be a leader, you will guarantee continued growth of the business and of the outcomes. That's what we do. We want to work with healthcare champions.
Mhm. Yeah. Now, your benchmarking data shows that 70% of medical affair teams actually don't analyze how their activities drive outcomes, and nearly 60% don't believe metrics drive decisions. When you saw those numbers, what did that tell you about the real state of performance and accountability in the industry?
It was not a surprise for me, Leanne. This was a hypothesis that I had made when I initiated and led the survey together with the Boston Consulting Group and the Medical Affairs Professional Society, which is the largest medical affairs nonprofit globally, which numbers over 15,000 members and professionals. But it was a confirmation that really validated what we started. It inspired me to continue really to educate and to build solutions, what it proved was that we avoid workflows, we avoid behaviors, those human factors, the incentives, and therefore should not be surprised when lots of talented professionals in pharma and biotech and medical affairs are simply not motivated to, not because they're not motivated about the science, about what they do, but about how their work is translated and interpreted. If you're using a CRM and your CRM is really not used to make decisions, or if you're, let's say, communicating insights about a medication that you feel it may not be as safe as you thought because your thought leader tells you that, an academic in a healthcare system, but your leader is afraid to send that on to their commercial leader for fear of perception as reality, then of course it's no surprise that you're going to not be very motivated to even communicate more insights, these insights that could be critical in maybe changing your protocol in your clinical trials. That's how this translates into the real life.
Mhm.
And so when I saw those numbers, I was inspired to continue to keep going, because Amadea Pharma really is the first agency, first company in the world that lifted the taboo off of quantifying the business impact of medical teams. When I first started to talk about this 7 years ago in 2019, 6 years ago, right? 2019, 2020, even provide the example of how medical drove revenue. People would cringe in the audience because, look, medical is not designed to drive revenue, right? But in the process, it actually does. It has much more impact because if you're a part of a business, whether you're medical, whether you're in compliance, then you have to take some accountability for the part of the business. So
Right.
that's the argument here, right? And now we're seeing that in 2025, fast forward 6, 7 years, now everyone's talking about how do we measure medical affairs impact, right? But we were the first ones. We're a small company still. We're growing, but we are determined to carry out our mission.
Okay, right. Now, and you've said that like accountability is usually something people fear, but Ancora is designed to make accountability exciting and motivating. Can you walk us through how you turn accountability into motivation? What's the actual formula or sequence that makes that shift happen?
Yeah, so absolutely. So, first of all, accountability is often seen as blame. So, accountability should not assume blame. So, you start off with that kind of rule that is based on Edwin Friedman's definition of leaders. He defines leaders as those people who are able to describe reality without blaming anyone, regardless of their title and in any situation. That is his quote, his definition of leadership. And that's what it really inspires this kind of expectation immediately, right? So if you want to turn accountability into motivation, make sure that there's no blame culture, right? Make sure that there's transparency, right? That people are distribute their accountability in a way that ensures that they will be motivated to be accountable to each other, to accountable to their customers and to their colleagues for performance as well as for behaviors, 50% split. Okay. So that's how you ensure that the accountability is welcomed, right? And is actually is practiced and not only a mere aspiration.
Right.
Okay, so that's the first step, really, right? To define it, and then you really give the accountability. You have to give it away. You have to distribute it in such a way that people are self-driven. Meaning, look, one of the first reasons why I joined the industry as a medical science liaison to begin with is I had observed others passionately defend their educational grants in their regions because they were actually given a budget. They were allocated a particular budget for medical education in New York, in LA, let's say, right in the territory that they covered. They're responsible. That's not done anymore today, right? But what if you were to distribute accountability across more sources? When you do that, now people feel like you have their buy-in. So that's kind of about the distribution, right? You have to distribute accountability differently, define it, right? And make sure that it doesn't assume blame. Then you have to measure what matters. Measure the accountability the right way. Who are the judges? Who are the players? What are the rules? What are the tiebreakers, right? You have to quantify the accountability in the right way. And your next step is really to make sure that you measure not only what matters, but measure the difficult things, those unseen things, those motivational behaviors that drive performance. Because I've learned from failures across my 21 years, and I've seen that you may have the best in class product, but if you don't account for internal workflows that are changing now due to AI or even back then, or your behaviors between sales and medical, if they have misaligned KPIs and only one gets recognition for their activities and not the other, it's not a surprise that they're not going to work together on a daily basis, right? So, so those team dynamics, you got to measure those behaviors as well. Like the employee experience. This is one of the biggest blind spots that people have, and that our platform, Ancora, is designed to actually quantify, right? So, because you know what, I mean, Deming, right? Edward Deming, the biostatistician, is the one that is known for that quote, measure what matters. You cannot manage what you cannot measure. But it was also him, many people do not know, that said that the most valuable things that you have to measure in order to manage a company are actually unseen and unknowable. It's difficult to know them, but you have to challenge yourself to measure that somehow. If we are able to measure pain, something as abstract as pain, through visual analog scores, or quality of life through 6 questionnaires which are validated by the FDA in our clinical trials, then we have to figure out how to measure ourselves, our own behaviors in medical.
Right.
You know what
Yeah.
I mean? And
Right.
we take that initiative, right? And then the final step is really to give that accountability away, really, which I mentioned earlier, right? But like, it stems from you set the right rules, you set the right metrics that are relevant to your team that distribute accountability, but then you step aside, because the best government is one that's least governed, right? Henry David Thoreau, right? Then you need to make sure that your team goes to work, as I mentioned, as if it were kind of a gym, but not a gym that they have a membership only, but a gym that rewards them for improving their own health and their team's health. So that's really are kind of my explanation of the process, the system.
Yeah, so taking accountability and first, making sure that you define it and there's no blame. And then you're distributing it. So there's, different people who are accountable for different parts. And then you're measuring it. So making sure that you have metrics, measuring the accountability and not only just what you can see and what's obvious, but also the harder, more difficult concepts. So you talk about connecting purpose, progress, and reward in one platform. Can you share a concrete example of how that connection changed behaviors or results on the ground?
Yeah, so I have three examples, and I'll try to choose one of them, Leanne, and try to be brief here. So there was a startup company that developed a first-in-class type 1 diabetes product that was overwhelmed with questions from all over the world about the product, when it would be approved in their country, how it should be used, and they were just overwhelmed. Okay. So I was brought in, Amadea came in, and we helped with operational efficiency, with creating more operational intelligence in the company. They had minimal KPI. They only had two metrics, two KPIs that they were tracking. And so what I did was I came in and I distributed the accountability between two departments that wouldn't otherwise interact or engage in particular activities. All right, medical information and the field medical science liaisons. One works in the field with customers. The others are usually in headquarters. They sit in headquarters and they just send standard responses, for example, or train the sales teams, but they usually have less face-to-face interactions with, the customers. And so I added more metrics, started to measure not only the not only number of the volume of information, medical information that was distributed, but also time to fulfillment, right? Because it's often very critical in avoiding hospitalizations, drug interactions. But most importantly, I set up one central master performance database, and I increased the cadence and the frequency of reporting. So now what happened was both these departments now started to help each other. They were more cognizant, they were more conscious of their performance. The MSLs started to step in and help write the standard responses themselves, even though that wasn't part of their job description. Okay. But what we did is that they didn't have to hire anyone else. They were planning to hire more people, which they didn't. We increased the efficiency by 150%. Increased the actual volume of the information that was sent fourfold, and we decreased the time. We increased the speed, basically. 4.9 days that it took to respond to these questions down to 2.2 days. And we saved a bit. The ROI was about 3.3x ROI. So we increased the ROI from a cost savings perspective, right? So here, everyone knew what the purpose was. The purpose was to improve their performance, right? The purpose was for them to help address these, increasing concerns from physicians, right? They knew about their progress, and then the reward at the end was really this company being acquired by a large company such as Sanofi, which everyone knows,
Mm-hmm.
and everyone really benefiting from that acquisition, being recognized, training the new team, integrating the team, and so this master database was one of the instrumental factors in making sure that the acquisition went through. And in public meetings, the global VP of medical actually told us at Amadea that you saved us. You saved
Wow.
us from, and so that was another moment that where I think we kind of connected the purpose to progress and reward, and more continuously. It
Yeah.
had a good outcome.
Wow, that's amazing. Now, one of the most distinctive parts of your work is weaving sports principles into organizational performance. When did you first realize that the sports model of competition, sportsmanship, personal records could be a blueprint for how teams in pharma and biotech operate?
So that took a lot of different reflection. There were probably two moments in addition to personal inspiration, of course. So one came at the company that I mentioned earlier, the GI company that focused on numbers, and they reported numbers and everything. They allowed autonomous goal setting. in addition to corporate goals by everyone in the field and medical. They allowed us to be entrepreneurial. They, in fact, stimulated entrepreneurship, where many of us started to form our own teams, and we had to build a business case for the kind of team we developed. We were given only 6 months to run that team, and so the team that I started was actually the only one that kept going for 2.5 years. And this was 10 years before AI became popular mainstream.
Hmm.
Okay, so I think I saw how it's really a relay. It's a team relay. It's not only an individual sport, but it's a team relay where you can have the best individual players, but the relays are also have to be, the passing of the baton has to happen in the right way, right? You can't drop the baton
Right.
as well. So it's not just about the numbers; it's about how the teams recognize the meaning of those numbers as well, and so that's what I learned at that company that became that scaled, as I mentioned,
Hmm.
that grew. And then the other the other moment I'll recognize is my observation early on of team building kind of events that included sports as well as innovation in private internal innovation events that took place for 3 months in a large company, where you were stimulated to submit ideas, solve problems together in a forum. And that now caused everyone to collaborate much more. For me, it was one of the most memorable moments of my career. And that's why I rediscovered myself as an entrepreneur, because I was one of the most active ones, as you can probably imagine, submitting lots of different ideas, getting recognition. But at that big company also, we had a team building event where we played volleyball, for example. And I remember how people's character now came alive during
Yeah.
that volleyball team building. Because look, in the work setting, there's a particular standard you uphold of your communication, but that broke down a little bit during sports, and people demonstrated their true character.
Right. Yeah, that makes sense. Yeah.
Sport, and you're able to practice what you preach when you're able to be animated, and it's the intensity of sports and sportsmanship really fuels stronger performance as well. You
Yeah.
know, and
Right.
so that's really what I've combined. Those moments is what I've combined into a management model we call deep metrics,
Hmm.
a continuous cycle of quality improvement that guarantees not just measuring but mastering performance.
Okay. Yeah, no, that totally makes sense. So on a day-to-day basis, people in the office, they have their guard up, they're working and, their personality or they're probably just more they withhold and don't share. But when you get into a sports environment, a competitive environment, people let their guard down
Yeah.
and they have more energy, which creates more connection and you get to know people at a deeper level. Yeah, that makes sense. Now, you've created the Medical Innovation Olympics, which is such a powerful metaphor of competition, live scoring, transparent criteria, and multiple rounds. What have you learned from running that event about how competition, feedback, and recognition actually change how scientists, founders, and medical teams show up?
Yeah, the Medical Innovation Olympics is a project that I'm very proud of, one that has attracted a large group of leaders, executives, CEOs of longevity medicine companies, epigenetics, gene editing companies, founders. And it really started with the idea of replicating that Olympic experience as closely as possible, because the intensity of competition is highest at an event like the Olympics. And it also is the only time when the entire world comes together for the best, for a good cause when you think about it,
Hmm.
right? So what I've learned organizing this together with our board for 4 years is that those who compete, when they know the rules and when they know the feedback in real time, and when judges are given neuroplasticity and ample opportunities to change their mind, even, right? So let's say, during the semifinals, for example, competitors present, and before the Q&A, they receive votes. The votes are displayed immediately. Then, as a result of the Q&A and the other competitors' final 2-minute statements, all the votes are now deleted. And then now judges vote again. So what we've seen is that from round one to round two, and to the semifinals and finals, the average scores from the expert judges always increase. And this is over 16 days of competition, where we don't just come out, from behind closed doors and just announce the winners, but we break down the scores across 5 different criteria that are specific to the concepts or the products across 2 categories. So the competitors know what to concentrate on, why they're getting the kind of feedback they are, and they're getting mentorship as well. So it's very intense. I can tell you from firsthand experience, it's truly an Olympic experience, an Olympic effort to organize, to
Yeah.
compete, to judge, to attend, maybe as well. But we have basically mastered this formula of excitement, which consists of 3 things: learn, compete, and connect.
Mm,
You know,
I
and
like
and
that. Yeah.
that's what, yeah, and that's how we've been able to demonstrate that our competitors have been invited to the White House. They've been recognized for their public health milestones and accomplishments. They've scaled their startups. They've raised money successfully, seed rounds. They've actually implemented their solutions and products into national medical associations, American Heart Association and others, and guidelines. They have implemented their medical grade wearables into Olympic teams as well. We have great case studies of where previous competitors have taken, their ideas. And this is done for 16 days. Now, what we can do is, because we've mastered this, can come into your organization as well, our team of Olympians, medical and commercial executives, and we can organize a private internal innovation Olympics that will generate excitement to scale excellence, right?
Okay.
And so we can do that for let's say for a month, for a set period of time, or
Hmm.
with our Encore Tech platform, to a lesser intensity, you can do that every day. And imagine what you can do with your performance if you created that same kind of workplace,
Right.
right?
That environment, that, yeah, nurturing that atmosphere of competition and excellence in a teamwork environment. And right. You talk about sportsmanship as a 50-50 balance between results and behavior. In life sciences, we often reward the numbers and ignore the dynamics. What does it look like to operationalize sportsmanship in a company? And how does that change the way teams handle tension, blame, or cross-functional conflict?
One of the reasons why sports, combining the transparency and the excitement of sports with the precision of data science, is so relevant today for everyone, not just people who are sports athletes or who are interested in sports. Because this is one of the biggest objections that I often receive, is that, look, I've left the corporate world because it was so competitive. I don't want to compete. That's not the idea here. Sports doesn't only teach you how to compete. It also teaches you about leadership, about how to work with the teammates, but it also teaches you about sportsmanship, right? About being accountable for your results, and also for your behaviors. Because if you resort to not following the rules, using a hockey stick in a game, you'll sit out, right? In a penalty box, right? Or in water polo, or in many different team sports as well, right? Or in individual sports, right? If you use steroids, for example, your medal will be stripped, right?
Right.
We don't do that enough. And this is why it's such an important and relevant formula, a sportsmanship based leadership in medical affairs, in life sciences, right? That also takes advantage of data science, as we do in our analytics company, in our tech platform, Ancora. And so how do you operationalize it? Well, you have to realize that metrics drive our behaviors and workflows, which in turn determine whether or not we meet those metrics or expectations or forecasts that your organization set. So if you only quantify one, and if you separate these, then you will always miss and have these blind spots, and which translate into mass layoffs, into a lot of wasted money and resources, into inaccurate forecasting, right? And into loss of revenue. Okay, so if you were to quantify or control for both the technical performance and the internal operations and workflows, then you're going to be much more likely to master your performance, to have more scientific and more realistic goals, which is important to investors, to leaders, to team members as well. Okay, so this is how you need to find a way, a tangible way, to make sure that the aspirational values that all of us share of productivity, performance, collaboration don't stay as mere aspirations, but you hold everyone accountable for them
Hmm.
with the right type of platforms or systems, which we've created, the Deep Metrics cycle and the Ancora platform. All right. So that's how we're operationalizing sportsmanship in a way that will guarantee continued growth of your business.
Yeah, no, that makes sense. Now let's layer in the elephant in the room, which these days is AI and agentic AI. You've warned that AI can generate the next best actions while completely missing the human dynamics that drive outcomes. How do you see a platform like Ancora sitting alongside AI? And what does responsible use of AI in performance management look like to you?
Absolutely. Agentic AI is now the latest trend. It's used, indiscriminately by everyone by now. We have a platform that also utilizes agentic AI that allows you to analyze and classify a lot of unstructured text, a lot of medical insights, and offer next best actions. But we also have a platform called Ancora, Decision Assistant, which addresses some of the gaps and augments agentic AI. And let me explain how. So agentic AI answers the question of what do I do next? What's the next best action? So it performs various workflows and uses reasoning, complex reasoning, multi-level reasoning, and multiple different steps where it has many sources of potential errors that can cascade as it autonomously searches various databases, for example. Okay, you give it that autonomy, right? But the decision quality, that next best action that it provides you, the NBA, avoids the impact of unseen behaviors that I talked about earlier, those motivational behaviors, right? That next best action may not consider how well a medical affairs team or how likely it is to work with someone in sales as a result of the workflows that they have, for example, right? Also, it has a high governance risk as well. Its KPI decision quality varies substantially from one to the next, right? And so what we do is we provide full explainability, right? With Ancora, you are in charge. You are the governance, if you will, right? You provide the governance of the technology that you use, meaning that you can very quickly configure the algorithm so that you can make decisions faster, earlier, and you can also answer different questions. You can address the questions of what is the KPI quality right now in this moment, because the quality of metrics changes across different life cycles or different
Hmm.
its relevance changes, really, right? Its metrics are dynamic. Instead of like spending months to come up with one metric, you need to monitor it consistently, monitor performance of metrics. And then secondly, how do I explain my decisions so that I build a stronger business case to get the resources I need using AI? So you track your decisions and you explain your decisions, as well as you grade the recommendations, the KPI quality with our system. Okay, and that's how you're able to make decisions that are more responsible. You eliminate more biases that agentic AI could theoretically introduce.
Right, right. Now, you've said you cannot expect anyone to work harder than you for your company. For
Yeah.
leaders listening who are feeling the pressure, like layoffs, tighter budgets, and more metrics, what mindset shifts do they need to make if they truly want elite, motivated teams instead of burnout?
Yeah, great question. So they have to be able to understand that transparency is no longer an option. It's a winning strategy. It's a winning strategy. When team members, even in difficult times, trust their leaders, they're going to be more motivated. They're going to give you their best effort, stronger effort. All right. So, you have to hold them accountable for results. You have to explain why you're making the decisions, but you have to give them enough autonomy. You have to give them the feeling that they own a piece of your company and accountability, and also recognize them along that tough journey or the marathon, right? Celebrate the small wins across that journey, which we are consciously doing. So that's how you continue to boost morale, but you got to be able to fail fast, even in tough environments. You got to fail fast, but learn from those failures. Always learn from that failure so you fail at something new every time. Forgive yourself, forgive other people for the failure, right? Focus on why you failed, but then fail at something new and then keep doing it, because, failing is also part of success,
Yeah.
right?
Right.
So, yeah. So, I mean, this is the kind of mindset shift where we have to embrace failure, embrace transparency and responsibility, but give accountability a little bit, distribute it across more sources than we're doing now, and for performance and for behaviors equally.
Yeah, that makes sense. Right. No, I like that. Yeah, failure is part of success. And you do have to learn to fail fast. Learn the lessons so you don't repeat them, and
Yeah.
then take that and grow from it. Right.
Mhm.
Yeah. Now, a lot of professionals in pharma and biotech feel like they are busy but not impactful. If someone listening feels that way, what is one practical step they can take and start this week to reclaim a sense of progress, purpose, and ownership over their performance?
Yeah, so I'm going to choose one. It's really find time to recover and find time for your escape. Find time for something where you can pursue what you want to develop, what you want to master in your life, a skill. And that's really the first step. Like this week, being busy can be a badge of honor, can be a necessity, because we all have different motivating forces. Not everyone works right now because of what they're passionate about. They may be working because of emotional pressure, financial pressure. You got to be sustainable, right? So you can't afford not to be busy, but find some time away, step out of your comfort zone and devote it to yourself, to enriching yourself, to educating yourself, whether it's an AI or a skill. Think 2 jobs ahead, maybe 3, 4 jobs ahead, or 4 skills ahead, right? You got to be entrepreneurial and build something, right? And then after you do that this week, afterwards, find a partner, one partner with whom you can share or communicate the progress, right? So you can then start to create momentum, you
Hmm.
know?
Hmm.
Maybe do your work somewhere else. If you're doing whatever you are now and you're feeling busy, maybe change, work in a different room. Change the environment a little bit, maybe, right? Change the scene, because maybe you'll or get a stand-up desk. Do something where you kind of interrupt that feeling of the repetitive, kind of routine, the routine of that may also be contributing to perceiving it as busy and no impact.
Yeah. No, those are all good pieces of advice. Yeah, yeah, several. I mean, just take time, step away, just to, clear your mind, make sure that you're looking ahead, like you said, like several steps ahead, so you can stay motivated in what's upcoming. I heard you say just find a partner to reflect with, somebody that you can help. I think that helps you stay accountable too, if you're telling someone else like what you're up to. Yeah. And then change up your environment. I like that too. Just that creates just a newness and freshness. It's refreshing. Um, yeah, and creating that new element can keep you
Yeah.
motivated. Yeah.
Yeah, but I mean, it starts with the recovery. You gotta somehow find ways to, and also it helps you with the recovery, right? And the
Hmm.
sports athletes, they know about the value of recovery,
Recovery.
which we
Yeah.
don't know in business, right? So, yeah,
Absolutely. Yeah. Now, if
yeah.
we fast forward 5 to 10 years and Amadea Pharma and Ancora have done exactly what you envision, what will work in healthcare look like and feel like for the medical team member, the leader, and ultimately the patient?
Yeah, so in a world full of a lot of exciting innovation that lacks a lot of talent that is excited about the work, uh, I'd like the industry to consider Amadea Pharma as a company that made work exciting and meaningful again in healthcare. That's the vision, because the excitement of work, the meaning in decisions will drive new standards of healthcare quality. And if you can do it in a tangible way, as we propose to do, this new management model, the way I see the future of medical affairs and healthcare is leaders who in 5 or 10 years will now lead differently, lead their teams differently with transparency. They'll realize that there are more ways to measure your performance now, whether or not you like metrics, and there are more ways to communicate. And there will be probably even more ways in 10 years.
Right.
So they will have to be more transparent because they
Mm.
won't be able to hide. Their performance is going to be exposed. And so in 10 years, I hope that we will be the company that will allow them to have the kinds of tools where they'll be able to practice what they preach, where their teams will be more excited about not just the purpose and what they do, the ultimate outcome, but their daily work, because your results start with your daily habits.
Yeah.
So we want to change, we want to redefine the concept of work within 5, 10 years. And it'll start with just a few companies, a few leaders, and we'll want to spread that kind of new way of leadership, because the platforms that we're creating are really a new platform for leadership in medical affairs.
Yeah, no, that makes sense. So yeah, just accountability requires transparency, and then you're helping provide the systems that put that into place, so
Yeah.
you're able to measure that.
Yeah.
And
But the
yeah,
word accountability itself is not exciting, right? And you have to somehow make it exciting or make it meaningful. And
yeah,
that's what I mean by what I say, that how we're scaling excitement to drive
yeah,
excellence.
right, right.
Yeah.
Well, Tim, this has been such a rich and energizing conversation. For listeners who want to learn more about you, Amadea Pharma, Ancora, or the Medical Innovation Olympics, where should they go online and how can they connect with you?
Yeah. First place would be to connect with me on LinkedIn. I'm very active there. I have a podcast called All Out Coach, where I inspire everyone to go all out, right? To actually stretch themselves and lift others, break down boundaries, transcend the differences they have between other people, and their roles and the responsibilities to leave their legacy, right? So I interview Olympians there. I'd love to have you as a guest as well, Leanne, at some point. So
I
yeah,
would love
connect
that.
with
Yeah.
So
Yeah.
connect with me on LinkedIn, and my email is timmick@amadeapharma.com, AMEDEA pharma.com, and go to my website, amadeapharma.com. Yeah.
Great. Well, thank you again, Tim.
Thank
And
you.
to everyone tuning in, thank you for joining us on Industry Ignited. If this conversation sparked new ideas about leadership, performance, or the future of work in life sciences, make sure to subscribe, leave a review, and share this episode with a colleague. Until next time, stay bold, stay curious, and keep igniting industry.